Hello, everyone. Good afternoon, good morning, good evening to you wherever you are. My name is Abua, and today I'm going to be walking you across this slide deck, which contains information on multi-level linear models. Some people would call this hierarchical linear models. So let's jump into our outline and let's get right into it. Okay, so first of all, we're going to be talking about why data would require multi-level or hierarchical modeling. Data would tend to occur in clusters, either by design or by accident, mostly by design. And then we'd also talk about random intercepts in a null model. This will serve as the foundation for more complex models when you add covariates to your models. And lastly, we'll discuss random slopes with a fixed covariate. We're going to be going through these in 3 or 4 parts. And so once we discuss one of the points in this outline, will take some time, and then you can revise what you've gone through before you move to the next video to see the other parts of this HLM or mixed model lecture. Okay, let's talk about cluster data. So sometimes when you look at a data set, you would find out that some of the data in your data set actually cluster around a variable that they have a relationship to. And what happens when this is the case? So for example, if you went about surveying people about what their favorite late night, weeknight show is, for example, you may end up surveying people belonging to the same family. And so when you go about the city and you do all of that, you would find out that some of those data points are related. So they are members of the same family. And you would not be surprised to find out that those members of the same family may choose the same late night weeknight show as their preferred. And you can already see that there's problems with this if this happens in your data set. We would say that that data violates your independence of data principle that is required for your linear regressions. But most times, cluster data are collected by design. So for example, when you're looking at people with repeated measures in a study, you see that all the observations for the different individuals are related to the individuals that you've measured time and again. So even though it appears to be in violation of the independence criteria for regressions by design. And so when you have this by design, you have to develop a method or methods that can adjust for these clusters and make your regression free of bias. Okay, so let's look at a couple more examples. We talked about in longitudinal studies, you have repeated measures. Other times where you take a measure again and again, maybe 2 or 3 times on the same subject. And then there are other times where people just in your data set are automatically in clusters. And we're going to see examples in the next slide. So here you are. So repeated measures for in longitudinal studies would be if you're on a blood pressure medication in a trial, your blood pressure will be measured before you start the new drug, and over time, the nurse or whoever would measure your blood pressure as you're taking the medication. Multiple measures on the same subject. So if they're doing research in your mouth, looking at your teeth, all your teeth hopefully belong to you, and so that's the cluster. You are the group, and your teeth are the individual observations in that cluster. Pause this, sorry, Ibro. Yes, and in cases where observations in your data set are just naturally grouped. Think about where you have a teacher teaching students in a classroom. Those students are tied to the teacher. If you're looking at how does a new intervention, maybe mastectomy, that's not new, versus standard of care in a clinical trial, you'd find that patients in different hospitals in that trial would be operated by different physicians, but groups of patients will cluster to groups of surgeons in your data set. So these are examples where you may, by design, have to collect data in clusters, and also you would have to develop methods to address this cluster. So your data can either be called clustered or called hierarchical. And so we're going to go into that a little bit. Okay, before we jump into the methods that I use to address cluster data, hierarchical level data, let's talk about why do we care about clustering? And the answer is because clustering can lead to bias. So we talked earlier about your data violating the independence criteria needed for regressions, and so that could lead to bias. But how, in what exact or precise way can it lead to a bias? Because the individuals, or because the observations in clusters resemble each other, it's going to lead to your results having smaller standard errors. And when your standard errors, if you remember from your regression, when your standard errors are smaller, your your T or your F statistics become large. And when your T or F statistics are large, your p-value becomes small. And when your p-values become small, your 95% confidence becomes very narrow and likely to be outside of whatever your null value is. And so what happens, of course, is that you are more likely to see an effect, a mean difference, or whatever effect size you're looking for, where there is none. And if you remember from your regression classes, this is called a type 1 error. You are seeing things that are not there. And so this is one problem that can occur when your data are clustered. And remember, this is called a bias. Your study results are not correct because you have not taken care of the clustered data. Okay, so we talked about earlier what there are things that you have to do to address clustering. Remember, we said you can collect cluster data by design. And so all you have to do is make sure that you address it. So there are 4 ways. You can use the pooling method. You can isolate or identify each cluster and analyze the data differently by cluster and use statistical methods to pool your results together and kind of find an average. You can also use the standard errors to correct the standard errors we're talking about earlier, and that's called a robust standard error adjustments can be done. But these two methods I just talked about, the pooling and the use of robust standard measures, are not part of what we're going to be looking at in this series. What we're going to be looking at would be the two methods below, which are the random effects model, which we're going into in this series, and also the generalized estimating equation models, which will be discussed in another series, I believe, by Dr. Abioye. Okay, a few things to note as you're thinking about your hierarchical modeling or cluster modeling. It is, and it's a refresher. So let's go over them. You probably can remember this first one from your regression modeling. The response variable. Your response variable is your dependent variable. It's your outcome measure. So if you're looking at whether smoking is associated or causes bladder cancer, your response variable, of course, is the outcome, the dependent variable. But there's new terminology that you want to go over as we move into this this slide deck properly. The grouping variable, these are the clusters that we're talking about. So if you, for example, if you had teachers across different classes teaching an intervention versus standard of care, then your teacher is the grouping variable, whereas the students are the individual variables. And the next one is your group level predictors. And so when you think about what I just said, some teachers are randomized to teach new material, other people are not teaching new material. You can see that you're at the group level. The students either receive new material, that's group one, or do not receive new material, that's your second group. But also it can be at the different groups, maybe at the different level of classes. There are group level predictors. And so if we're thinking about that same example of teachers teaching students, you can say a group level would be, what is the proportion in each class, or in each class led by a teacher, of course, of students who read at a higher level than the average. The assumption being that these people probably would be able to gain the material better and would do better irrespective of whatever material was being taught to them. And lastly, on this slide, what we have is what are the individual level predictors. So remember that in a regression, we're still trying to understand, in most regressions, not in every regression, we're still trying to understand what is an individual's likelihood of a response, or what is a risk for this individual to get this response or to avoid the response. And so you have to consider that you in your hierarchical modeling, you still have to consider what are these individual level predictors that can affect the outcome that you're looking at. So just a refresher for you, something new, something old here, but it's always good to come back and do some thinking through. This would help you when you see the examples that we're going to go through. It would help you set the stage for how you approach your hierarchical or linear model. Okay, let's look at an example. So nurses were randomized and trained on the new sanitizing practice versus standard of care, and this was to be implemented in the burns unit of a hospital in Harare, Zimbabwe. Each nurse was responsible for 5 to 7 patients on their respective wards. Researchers wanted to measure the impact of the reintervention on the risk of wound infections. So let's go back and say, what's our response variable? Of course, it is the risk of infections in these patients. What is the grouping variable? So the grouping variable, of course, is whether these patients were receiving the new sanitizing practice or whether they were continuing with standard of care. And what are group level predictors here? And so your group level, your grouping predictor or your grouping, your group level predictor would be your nurses, but also maybe in some wards, there's a higher proportion of patients who had superficial wounds, which are less likely to get infected versus others. So you want to capture that in your study, and the individual level predictors could be things like what's the nutrition status of the burn victim, and these we know can impact whether a patient gets their wounds infected or their wounds healed properly. Okay, so that's a good example for you to go over and think through. And so we've come to the end of this section. for the hierarchical linear modeling. But just to leave you with a few questions to think about. Consider any of the studies you may have been involved with in the past and whether those studies actually had clustered data. And because you did not know what to do about it, you just went on with your regular regression. What was the response variable? What were the grouping variables? And in future, how will you address cluster data in the future? So thank you very much for listening. Feel free to go over this one more time or as much time as you need, and then join us in the second segment of the hierarchical linear modeling session. Thank you.